In this brief video proposal, our team of public health experts will address multiple population health issues in Uzbekistan. The reason for this is that in comparison to the average regional values of Europe, Uzbekistan fails on nearly all key health indicators. Clearly, a public health strategy and intervention is needed. In general, the burden of disease is described in terms of disability-adjusted life years, otherwise known as DALYs. And according to the Global Burden of Disease Study, the top 3 causes of DALYs in Uzbekistan were ischemic heart disease, lower respiratory infections, and cerebrovascular disease. Even though lower respiratory infections seem to be an important health issue in Uzbekistan, there has also been a significant decrease in its overall impact on the burden of disease. In general, throughout the last 50 years, there has been a shift in the burden of disease from communicable to non-communicable diseases. This can be attributed to the recent economic improvements of Uzbekistan. Currently, after examining the data, Uzbekistan appears to be undergoing a slow process of epidemiological transition.
The top 3 causes of death in the Central Asian country are cardiovascular health problems, strokes, and cancer. Ischemic heart disease is one of the more common cardiovascular problems in Uzbekistan. It is a major issue in the country as it impacts 39% of individuals aged 0 to 64 and 78% of those 65 years and older. Next, the World Health Organization noted that the number of deaths due to strokes in Uzbekistan had reached 29,176 citizens in 2014. The age-adjusted death rate ranks 12th in the world at 168.58. Cancer has the reputation of being one of the most common causes of death in the world. Fortunately, Uzbekistan has the lowest cancer mortality rate out of its Central Asian countries. Around 60 per 100,000 individuals are impacted with cancer in Uzbekistan.
The 3 main public health issues that need to be addressed urgently would be the top 3 causes of death, which are cardiovascular disease, stroke, and cancer. From WHO data on estimated deaths, cardiovascular disease is the most deadly disease in Uzbekistan. 26% of men are overweight and 21% of women are overweight, as stated by the Uzbekistan Health Examination Survey. The results showed that eating an animal source of protein and smoking had a strong relationship with obesity. The obese population was 3 times likely to suffer from the disease like hypertension. By improving health habits of the general public, we might be able to decrease the rate of cardiovascular disease. The second issue is stroke. According to WHO, stroke caused 78 deaths per 100,000 people, which is the second leading cause of death in Uzbekistan. There are many reasons why stroke occurs, including high blood pressure, aneurysm, weak heart conditions, and blood disorders. The general risk factors of ischemic stroke conducted in 2011 showed that heredity, cerebral vasculitis, hypertension, heavy drinking, smoking, tobacco, and long-term use of contraceptives were the main risk factors of ischemic stroke in the young population of Uzbekistan.
As for the third public health issue that needs to be addressed is cancer. This disease happens everywhere, in both lower income and high income countries. In 2001, around 7 million people died from cancer. In the same year, there are 10 million new cases of cancer. It is also one of the top 3 causes of death in Uzbekistan in 2010. For relevant risk factors, according to GBD 2010 studies, dietary risks, high blood pressure and high body mass index are the top 3 risk factors in Uzbekistan. Dietary risks are associated with approximately 15% DALYs attributable to cardiovascular and circulatory diseases. Tobacco is also the leading cause of cancer and cardiovascular disease, estimated to kill more than 5 million people every year.
Uzibekistan's action plan would be to promote healthier lifestyles by implementing population-wide policies to reduce behavioral risk factors, including harmful use of alcohol, physical inactivity, overweight, obesity, and high salt intake. This can be done by creating a program to train individuals in basics of healthcare. This will ensure that smaller, less serious illnesses are properly taken care of to prevent further infections. Since Uzbekistan has a relatively young population, it would be important to target younger populations first to minimize future incidence of any diseases. The costs for implementing these preventive programs are much lower compared to the treatment needed after diagnosis. The expected results of the interventions would serve society by increasing the life expectancy in the population within 7 to 10 years of the action plan.